biopsy is a medical procedure wherein a small amount of tissue is taken from the abnormal area, either picked up by you or by any other imaging modality, and it undergoes testing under a microscope by a pathologist. It is the only definitive way to diagnose cancer. It tells us whether that abnormal area is a cancerous area or not. It tells us about the grade, hormone receptor status, or if we are subjecting that tissue to any germline testing. It helps in that also. It helps us in determining what kind of treatment that we should give for you. Let's talk about the common types of biopsies. So this depends upon the location, size of where that abnormal area is. So needle biopsies are there, what we call as fine needle aspiration, and the other one is core needle biopsy. In both these procedures, a needle is used to take out either few cells or a small piece of the tissue for examination. The other way is called a surgical biopsy, wherein we make a small incision, take out a small representative area surgically and subject it for examination. When the lumps are very small, like as in breast, where we need the whole lump for examination, then we perform something called as an excisional biopsy, where we take out the whole lump and subject it for testing. So removal of the lump is only going to be the treatment for it also, as well as it will give us the result also. Sometimes depending upon the locations, an image guided biopsy is also done, very commonly used in lung cancers, where under a CT guidance a biopsy is performed. The other one is an endoscopic biopsy, where an upper GI or a lower GI endoscopy is done, and when any ulcer is found or any polyp is found, it is subjected for biopsy. And the other one is going to be our bone marrow biopsy, where some amount of tissue is taken from the bone marrow, aspiration, and it is subjected for testing. As we prepare the patient for a biopsy, some of the times we ask the patient to stop taking some blood thinners if they are on any blood thinners for maybe 48 to 72 hours prior the biopsy procedure. And a small amount of local anesthesia is given on the skin, or some sedation is required depending upon what type of biopsy we are performing. And then a small needle is inserted, and a small chunk of tissue is taken for examination. After the biopsy, majority of the times the patient does not feel any discomfort, but the patient is observed for around half an hour to 1 hour depending upon the type of biopsy and the organ that has been biopsied, and then they will be sent home. It is a myth that many people have that doing a biopsy causes spread of cancer, but it is not so. Doing a biopsy does not cause spread of cancer. The tissue sample that has been biopsied is next sent to the pathology department, where it undergoes multiple layer of testing, and it is examined under the microscope by the pathologist. We get a result saying a final histopathology report, where they tell us about what the cells look like, whether it is malignant or not. Some immunohistochemistry tests are also performed on it. At the same time, molecular and genetic testing is also done on the same sample. Many of the patients asked, does a biopsy hurt? No, a biopsy doesn't hurt. Maybe some uncomfortableness for maybe just immediately after the procedure, but definitely it doesn't hurt. And how soon can I get the result is the next question. So the histopathology report will take around 3 days time to come, and if some additional tests are performed like IHC or some germline testings, it may take a little longer depending upon what test has been asked. So as I've mentioned, please don't be under the impression that biopsy will cause spread of cancer. No, biopsy doesn't cause spread of cancer. It is just a procedure to help us diagnose cancer, to help us treat the cancer also. So please don't be under that impression, and when anything abnormal is there identified, either by you or by any other imaging. Once you see the doctor may ask for a biopsy to confirm the diagnosis.